Good morning, good afternoon, depending on where you are. We're so glad to have you here with us today for the fourth and final session on elder justice for the month of June. I am Amy Herrera, Special Agent of the FBI's Washington, D.C. field office. Before we get rolling on today, which is packed with great content, I have just a handful of quick administrative things to cover with everyone. First off, yes, we are recording the session today. Yes, you will be able to access it likely tomorrow on a public facing website. You'll get that website address in an email tomorrow, and I'll put it in the chat box here in a moment when I'm done with the administrative. So that's coming. Second, we do have a handout for you today as well. It comes to us courtesy of our partners at the U.S. Department of Health and Human Services. It is a poster about elder abuse. You're welcome to download that handout now if you'd like. There will also be a link to that handout on the website tomorrow, so you can snag it at your convenience and share it widely. If you are a member of the media, fantastic. We're glad you're here. Please reach out to us directly through the chat box or the question box, and we'll connect you with the appropriate public affairs person to help you in writing your story. If you are attending today to earn continuing education credits for your job, we don't issue that directly, but tomorrow in the email you'll receive, you'll have a certificate that confirms your attendance today, and you can send that certificate to whatever group typically or offers you the CEUs for your job. So look for that email tomorrow with a certificate. If you have questions today, fantastic. The whole purpose of today's session is to answer any questions that were not answered in our prior sessions on the same topic. So the more the merrier. As you have questions, type them in the box, because we have a whole set of about a dozen people that are here only to answer your questions in writing. So the structure today is different than our typical sort of structure. You're going to see on screen a handful of panelists who will be walking through a set of questions. We pulled the questions from prior webinars in this series because they were questions that people asked and we didn't have the chance to address. So the questions that you'll hear are ones that you yourself raised in prior webinars, or when you registered for this webinar, you said, I'd like to know this particular thing. So that's what our speakers will be walking through. Meanwhile, there's a dozen folks on the back end that are going to answer whatever questions you type in today. So please, as you have questions, type them in the question box. We have tons of people who are anxious to share their expertise with you. In fact, on the back end today to handle your written questions, we have folks from the FBI, from the Senior Medicare Patrol, from the DC Medicaid Fraud Control Unit, from the U.S. Department of Health and Human Services Office of Inspector General, from the National Center on Elder Abuse, from the DC Department of Aging and Community Living. So tons of expertise, federal, state, local nonprofits. We're here to answer whatever questions you have. I think that is all of the admin for today. Hot dog! So as part of this ongoing series that is primarily led by the National Capital Region chapter of InfraGard and the Washington, D.C. field office of the FBI, I am very pleased to turn the virtual microphone over to Wayne Jacobs, who's the special agent in charge of the criminal division at the Washington field office, and he will lead us through our panel discussion today. Mr. Jacobs, sir, over to you.
Great, thank you, Amy. Much appreciated. As Amy mentioned, my name is Wayne Jacobs. I'm a special agent in charge for the Washington field office's criminal and cyber division. I first want to start out by thanking all of you for joining us today. Recognize that the time is a precious commodity, and it says a lot about all of you and your faith in us to take some time out of your day to get smart on the issues that we're going to talk about here this afternoon and this morning, I guess, depending on where you are. So thank you for that. Obviously, we here in the FBI, along with our partners, work incredibly hard to address a lot of society's wrongs, but we certainly would much rather be in a position where the types of things that we're going to discuss today, elder abuse, fraud, don't happen in the first place. And so our primary mechanism to do that is to educate. That's been the purpose of these 4 sessions that we've had. Our hope is that you've been able to take some things away that will help you in your discussions with family members, loved ones, friends, colleagues, what have you, about things to look for, what to pay attention to, what questions to ask, and how to engage with law enforcement or other supporting entities to get you answers to the questions that you have. which is obviously a nice segue into the focus of today's discussion, which is, again, a collection of questions that have arisen from the previous 3 sessions. So really excited that we have a panel of experienced experts who work through these questions. As they answer them, and as you think about other questions, please use the chat feature to write those in, and we'll do our best to get to those at the very end of the discussion. So I don't want to take up any more time here. Again, there's a lot of great content that we will get to. So we're just going to roll right in. I'm going to ask the panelists to introduce themselves, and then we'll go to questions. So Jenny, if you don't mind starting us off with an introduction.
Yes, hello. I am Jennifer Trussell with the SMP, Senior Medicare Patrol Resource Center, and I recently retired after 35 years of federal service, 10 of those being active duty Air Force, and most of the remaining 25 with Health and Human Services Office of Inspector General, where I retired as the Special Agent in charge of investigations.
Great, thank you. Jen.
All right, my name is Jennifer Sperry. I am the Executive Director of the National Adult Protective Services Association since last fall. Prior to that, I worked in the city of Philadelphia, most recently as the Director of the Older Adult Protective Services Department, and oversaw 70 employees, and we received almost 5,500 reports a year, unfortunately, of elder abuse. And prior to being director at NAPSA, I was on the board of NAPSA. So I'm really excited to be here and to share APS's world with you.
Outstanding, thank you. Clarence. Looks like we may have momentarily lost Clarence. So we'll pivot. And Aaron, are you with it?
Well, Clarence is back. I'll let Clarence go.
Okay, perfect.
Sorry about that. Good afternoon, everyone. I'm Clarence Holliday, Senior Special Agent with the United States Department of Health and Human Services, Office of Inspector General. I've been a special agent since 2007, and I've been working healthcare with HHS since 2011. Thanks for this opportunity.
Fantastic. And last but not least, Aaron Weeder, go ahead.
I apologize. I'm not on the video. You won't see me, but I hope to join that shortly. My name is Aaron Weeder. I started with the FBI in 1998, was assigned to the Washington field office to a healthcare fraud squad. I stayed on that squad and investigated healthcare fraud as an agent for the next 20 years. And then for my last 3 years, I became the supervisor of that squad. We focused Northern Virginia, DC, Maryland, and I have a CPA and a CFE, so kind of financial fraud is my game, and I appreciate being invited to participate today.
Fantastic. Okay, so we're just going to roll right in. First question: how can I recognize red flags of healthcare fraud? And we'll start with Jenny.
Yeah, thank you. You know, when it comes to recognizing the red flags of healthcare fraud, certainly a little common sense comes into play. Are you billed for something, you know, that you didn't receive? But there's some more nuances there that I think that it's important to look for. The simplest thing to remember is, was that care unsolicited? Your doctor didn't order it. Perhaps you received a robocall about it, or you know, someone knocked on your door, or perhaps it was a group visit in assisted living. You know, was it not even requested, and you may not even need that care. And so, you know, I think that those are the most important things to remember, and then I'll go ahead and pass it along to our other panel members.
Fantastic. Clarence, anything to add?
Yes, and to add with that, you know, we all receive our explanation of benefits after we've been seen for a medical visit. So that'll kind of explain what's the practitioner billed for. So that'll give you a good idea of the service that you receive versus the services that were billed for. So if you guys could get familiar with just taking a look at that EOB once that comes in following a doctor visit, it'll give you some facts that can lead towards those red flags.
Fantastic, great advice. And Aaron.
Yeah, so to get into some specifics on kind of things to watch for, so with those EOBs, take a look at them. Look at the dates of service. Look at the providers. Do you recognize the date of service as being a date that you actually were at the doctor? Do you recognize the provider that's listed as someone that you actually saw? Sometimes in practices, there are bills that are submitted under a supervising physician that may have been provided by a physician's assistant, for example. So it's not necessarily the case that that it's fraud, but it's just something to be aware of. You know, were you in town? Was your loved one in town when those services were purportedly provided? Were they traveling? Were they staying with you? Were they somewhere else? Another thing to keep in mind is if you stop receiving EOBs, if someone has stolen your identity and has started to get those EOBs sent to them, there are schemes that involve providers that are folks that steal identities and then have the payments sent to them instead. Finally, if you or your loved one is receiving unsolicited, as Jennifer said, unsolicited supplies, durable medical equipment on their doorstep, that's often the case where telemarketers have identified folks, have gotten their personal information, their medical billing information, and will just begin to ship these unneeded supplies to them. But those are some of the things that we see most often.
Great, thank you. Yeah, I think just to sum, you know, one, pay attention to the details, look for anomalies, and when in doubt, ask questions, right? So, okay, question number 2. What are the main signs of elder abuse? And this one will be directed to Jen.
All right, this is a softball for me after 18 years working in the field. There are obviously many forms, and unfortunately, they don't exist in a silo. We have something, we termed it about polyvictimization. So where there's smoke, there's fire is kind of an adage we've used. There's physical abuse, obviously physical, you know, punching, binding, you know, scratching. Emotional abuse, which is more of a verbal abuse, and it can be just as detrimental as the physical abuse, and sexual abuse. There's also 2 types of care of neglect. There's the self-neglect, which some states don't investigate self-neglect and have the area agencies on aging or home community-based services handle that. And then there's the caregiver neglect. And financial exploitation, which I can tell you, self-neglect has always been the most reported form of abuse or neglect exploitation, but financial exploitation is now right up there with it. And because it can cover so many different areas. And some states actually look into abandonment as well when there's a caregiver that had a duty to care. But again, like I said, there's polyvictimization. So just because you see, you know, you could see mail piled up on a front doorstep, once you get inside that house, you can see so much else, so much other forms of abuse or neglect, exploitation going there. So again, where there's smoke, there's fire. So I hope that covers all of it.
It does, thank you. Okay, question number 3. Where and how can I report financial fraud against older adults? And then where and how can I report healthcare fraud? So 2 different components to that question. We'll start with Jenny T.
Yeah, I'm going to go ahead and address the healthcare fraud aspect of this particular question. This should be a simple question. And I can't tell you how many times people have said, I didn't report it because I didn't know who to call. I didn't know who to report it to. It's so complex. The answer is basically that think about the agency that would be appropriate. For example, if it's Medicare, call 1-800-HHS-TIPS, TIPS, or 447-8477. Also know that the SMP, Senior Medicare Patrol Resource Center, can be contacted at 877-808-2468, but no need for you to write all of this down. Think about just typing into, you know, an internet resource that indeed report healthcare fraud, and you'll get, of course, many of those links that I just mentioned. Contact the FBI, contact the local field office, or 1-800-CALL-FBI. If indeed you have, you know, a general health care. But what if it was a specific private insurance? Chances are that number is right on the back of your card. And if you just don't know who to call, oftentimes there are services such as the AARP that can get you headed in the right direction. There's a difference between reporting elder abuse, financial fraud, and healthcare fraud, but regardless, a simple internet search or calling one of the main agencies who cooperate with one another will get you headed in the right direction. And then Wayne, I'll go ahead and turn it back for the financial fraud aspect of that.
Sure. So Jen, did you want to try and cover that?
Yeah, absolutely. Because obviously, I'm going to say Adult Protective Services is one place you could turn for this, but to explain, every state has a different statute. And so there's a criteria typically in most states where there's some type of vulnerability, and that could be emotional, it could be physical, physically they're bedbound, or they could be afraid. But there's some sort of adult vulnerability there. So APS is not always the answer. And Jennifer brought up some great resources there. I always used to like to tell my staff, and now the country of APS, think about if it's a Veterans Association problem, then contact the VA. Every organization seems to have a type of, fraud collection, where to report. The Social Security definitely does, like Clarence said, through his office, right? The Office of the Inspector General is very interested in Social Security fraud. But financial fraud, when it comes to an older adult where they don't know what's going on, they don't know what to do, APS is a very big resource for that.
Fantastic. And Aaron, I know Jenny already hit on how to report to the FBI, but anything further you want to add there?
Yeah, the only thing I would add there is if this is an internet type of scheme that's coming to you or your loved one through through the form of the internet, emails, texts, or other things, you can go to IC3. That's IndiaCharlie3.gov. That's the FBI's collection system for internet types of schemes.
Fantastic. And then Clarence, anything from HHS's perspective on how to report?
I think Jenny touched on that. Again, just following up, you can hit contact tips.hhs.gov, and it'll give you all the prompts that you need to make a report, and even educate yourself on how and what to report.
Great, thank you. Okay, question number 4. What can I listen for when talking to my older parents that might indicate fraud? And again, we'll start with Jenny.
All right, thank you. Thank you, Wayne. This is one of my favorite questions to answer. It's not just listen to your parents, it's watch. Do they have packages piled up on the step or at home, full of durable medical equipment, braces? Maybe it says genetic tests on there. They start getting unexplained packages related to healthcare. That is a big red flag. So watch in addition to listen. But when it comes to listening, are they confused? You don't want to shame and blame. You want to inquire. This can be really confusing to seniors, and the fraudsters just prey on them in very sophisticated ways. Are they confused or excited about healthcare? Their healthcare. In other words, they're getting services they don't understand. Talk with them about it. Or are they really excited because someone is talking to them online on a daily basis about their healthcare? That's certainly an indication perhaps of telehealth fraud. Perhaps you can sit down and jointly look at the statements. Those statements can be confusing. The S&P actually has some resources about how to read your Medicare statement, as do other agencies as well. And are they talking about numerous or significant diagnostic tests, genetic tests, x-rays, blood work, allergy tests, physically, all of some of these, when there's a significant amount of diagnostic tests and they don't have a pre-existing condition that would justify that, that's certainly something to listen to as well. But finally, and I can't emphasize this enough, medical identity theft is a huge driver of healthcare fraud. And if they're talking about how someone was asking them about their Medicare number, any request for personal health information, PHI, or personal identifiable information, Social Security number, date of birth, even an address can be a red flag. It's a long-winded answer to a short problem, but it's important to listen and also watch when it comes to looking out for your loved ones and your parents when it comes to healthcare fraud.
Yeah, a lot of great information in that response. Thank you, Jenny. Any of the other panelists want to offer anything else? Okay, we'll move to the next question. How can I help family members who are financially exploited? Jen, we'll throw this to you to start.
Yeah, I love this question. So, because I always like to remind everyone that these are adults we're dealing with, and the NAPSA Code of Ethics is really rooted in self-determination and autonomy. So the first step to me is to talk to the person, talk to your family members. And like Jennifer said, don't victim shame, really just listen, watch, observe, things like that, but help and stop the bleeding. If there is something going on and you can gain that trust relatively quickly, stop the bleeding, get to the bank or report to whomever may be involved. Make a report to APS or the police if needed, if indicated, and seek legal counsel in some instances. And IC3 was a great referral that I believe Aaron gave out, just because a lot of these internet crimes can be pieced together. And I know sometimes in our world we think, oh, it's just one, but there's a lot of these just ones going on out there. So talking with your family members is just really keeping them at the forefront of making their decisions, because it's their life and you don't want them to push away because you've shamed them. There's a very real fear sometimes when you're working with family or older adults, especially, of losing some freedoms, taking away car keys or going to an institution, or just the distrust that they may feel when their kids come to them and say, Mom, Dad, what did you do this? And it's a wild world out there. Any of us could get caught in any of these kind of schemes. So creating a prevention plan going forward is always a good step as well. So that's it in a nutshell.
Yeah, and just want to amplify the piece about sharing information, reporting, even what seemingly is something insignificant. Every piece for us within the law enforcement community is valuable and can help inform a much larger problem. And so we're only going to be able to address those issues if we know about them. So again, coming back to the ask of making sure that you report these things when you're seeing them. Okay, next question. What sorts of fraud, abuse, or neglect can happen in hospice settings? Jenny, we'll start with you once more.
Okay. Hospice is a long-standing healthcare fraud problem that got even worse during the pandemic. I'm going to make 2 points, and then I want to pass it over to the other panelists. The main point that I want you to remember is that medically necessary hospice care. If you or your loved ones were approached and said, hey, Medicare, you no longer have to be within 6 months of end of life to get hospice care, that's a red flag. If you're offered housekeeping, okay, it's a new benefit with hospice, that's a red flag. If you're being offered that, hey, by the way, we can pay bonuses if you sign up for our hospice program, that's a red flag. So let me emphasize that there is so much fraud right now with medically unnecessary hospice care that is an important point. And the second point I want to make is, did they show up? If you genuinely have someone on hospice care, did those hospice individuals, hospice is an amazing program that has been beneficial to so many, but the people have to show up and provide that care. And sometimes we see a problem with that, especially when it comes to staffing shortages. So at this point, I'd like to pass it over to the other panelists to make other important points.
Great, thank you. Clarence.
Yes, a few points that I have to add is also, again, just reiterating the medical unnecessary therapies. That's one of the things that we see a lot of. Also, a lot of hospice facilities are now reporting that they provide burial benefits. That's a red flag. That's not accurate. And a lot of times we've seen unqualified providers or facilities. So again, just checking the background of the facilities that your loved ones are being serviced by, are just a few points that I wanted to add.
Great, thank you. And then Aaron.
The only point I'll add, I went through this with my own mother-in-law here at the house. It's amazing the amount of medication hospice patients and older adults can be prescribed. And then, when they pass, that medication is all there for you. And it's also there for you and anyone else in your house throughout the term that the loved one is with you. So I would encourage you to, a lot of these medications tend to be anti-anxiety and or pain medications. Come up with a plan to lock up those medications while your loved one is there with you, and come up with a way to control who has access to those medications. And then finally, once your loved one has passed, make sure you have a plan. I'm sorry. I think I'm dual enrolled here.
Double the great advice. Okay. Aaron, were you able to work it out, or should we just roll to the next question? Okay. While Aaron addresses his technical issues, we'll just move to the next question, which is, what issues can arise in assisted care institutions and home health aides? And Clarence, I'll actually start with you on this one.
Okay. It's a variety of different issues that can arise. One, in the institution, again, you can have the fraud of personal identifying information of individuals, older adults that's in that facility. Financial exploitation, if they have credit cards, jewelry, or things of that nature in a facility, but even at home, having a home health aide, again, having jewelry, things of monetary value that ends up missing. So again, the big piece that's in the home health arena is the financial exploitation, as well as billing for hours that's not being worked. So for instance, if you're supposed to be at a home with an individual for 4 to 6 hours, and they're there 2 hours a day, but still getting paid and billing for 6 hours a day. So that's one thing that we see a lot of with the home health aides. And again, in the institutions, it's more of the quality of care issues are what we see, the lack of quality of care. If a loved one, with the lack of quality care, you notice behavioral changes, nonverbal signs, and things of that nature, poor hygiene, and with the current climate that we're currently in with the COVID-19, just employees and residents following extreme safety precautions. So if one is infected, they're not spreading it throughout the facility. So those are some of the points, the issues that we see that can arise in institutions and from a home health aide.
Great, thank you. Jenny, anything you want to add?
Yeah, I absolutely want to mirror Clarence's comments. He made some excellent points there, and there are just two kind of different ones that I want to add. One is an additional problem that we're recently beginning to see in these assisted living facilities is group solicitation. In other words, an individual comes in and is selling a new Medicare plan. And they try to convince everyone in that assisted living facility that, their current Medicare insurance plan doesn't cover COVID or may not cover COVID. And, so they try to talk them into a plan which they're probably getting a commission on and may be inadequate. But even worse, they could be doing group COVID tests and asking everybody for their Medicare number and a copy of their driver's license and maybe even another health insurance card. And oftentimes those are group attempts at identity theft. But I do want to end with one additional comment. The assisted living is different than your nursing home care, and yet that distinction is lost on many people. And so oftentimes we find that seniors are in assisted living, the assisted living facilities, many times they often look nicer. Sometimes they have better staff, they have recreational activities. Perhaps they have a cafeteria style that looks enticing. But there comes a point sometimes when a senior is in that facility and the level of care that they need cannot be supported by the assisted living facility itself. But the assisted living facility doesn't want to give them up, nor does that individual want to leave. And those are some tough decisions to make. So there's definitely an addition, but there's definitely a difference between abuse and neglect and whether or not that senior is in a facility that is appropriate for them. And those are some of those are two additional points that I want to make on the topic of assisted living.
Great, thank you.
Can I
Okay,
add something, Wayne?
Yeah, absolutely. Jen, go ahead.
I was just thinking when you were talking about, people coming into the facility, there's several instances in APS where you always want to keep your guard up and watch who's visiting, what times, what's going on, because documents like deeds and power of attorneys can be signed, and that will give them a license to just go crazy with whatever financial accounts they have. But deeds are really an easy thing, come on, sign this, and then there's their property, which can also impact their nursing facility grant and all kinds of issues. So it's a really good tip to watch who's coming in and out of those rooms, because sometimes when you have warring family members, that's a good opportunity to have the older adult by themselves and have them sign whatever. And if there's diminished capacity, don't get me going there. That could really open up a whole world of trouble. So just wanted to add that.
Yeah, no, appreciate it. Thank you. Okay, Aaron, so you're able to join us. Great to see you. Question number 8, which is for Aaron, so great timing. Can I put a hidden camera in my loved one's room at a nursing home if I suspect that my loved one is suffering abuse or neglect?
So the answer to that is yes and no. So what I would say the first step would be is go back to what Jennifer and others shared as to how to report healthcare fraud. Reach out to the FBI, reach out to HHS first before you consider doing anything like that. There are legal ramifications for installing either audio or video equipment in a private setting where there's an expectation of privacy. So if you reach out to the FBI or the HHS agents in your area and get them on board, they will help guide that process and will obtain the necessary legal authorizations to do so. So we did that in a case a number of years ago. I think some of the folks on this webinar have probably heard about that case in a previous presentation where we installed a device in the room and we were able to take video in that case. We obtained the authorizations through the spouse who had power of attorney to provide that, but separately, we also obtained a court order from a district judge, U.S. district judge in that district to authorize that recording. So that kind of pushes that responsibility onto the FBI and HHS as opposed to the loved one to handle that appropriately. So the short answer is yes. It could be no if you do it yourself, but the main thing we want to do is make sure that we get the best possible evidence of that fraud or abuse, and that at the end of the day, that evidence is admissible in court. So if the proper policies and procedures aren't followed, it may be great video, maybe great audio, but it might not be admissible. So thanks.
Great, thank you. Okay, question number 9. I feel like we've answered this question, but I'll certainly read it again and see if there's anything else the panelists want to offer. Do you have any tips we can use to educate our clients, Ari, how to identify and report healthcare fraud? Jenny, I don't know if there's anything else you wanted to add or if any of the other panelists wanted to share anything else.
Yeah, I think actually very quickly, because of the fact that there's so much information on there about how to report healthcare fraud, I think this is actually an important question to emphasize the point, to make it simple. The S&P often assists individuals one-on-one with resolving that issue. Perhaps they need a new Medicare number because it's been compromised. And as a result of that experience, we have developed this very simple phrase: prevent, detect, and report. And if you can remember that prevent, detect, report, whether you're educating clients because you're a caregiver, whether you're educating your parents, whether you're trying to educate yourself, you prevent by not giving out your number or, avoiding unsolicited services. You detect by reading the statements that we've talked about before, making sure those services were ordered by your personal care physician, and of course, call the appropriate agency to report. But if you remember 3 things, prevent, detect, and report when it comes to educating people about healthcare fraud.
That's great. Thanks, Jenny. Everyone loves a good acronym inside the Beltway here. PDR, prevent, detect, report, easy to remember. So thank you. I don't know if any of the other panelists wanted to offer any other tips, but I think that pretty much hit it. Okay. Question number 10. What sorts of resources or supports are available for victims? Jen, we'll start with you.
Right. Obviously, I'm going to say APS, Adult Protective Services, but again, it's if there's a vulnerability there. So you get a victim and you can't really work with them because there's issues about access or there's issues with their diminished capacity. APS in most states have statutes where they can gain access and they can work with somebody with diminished capacity using whatever tools they have in their belt. But there's a lot of different, there's like the fraud hotline, securities helpline for seniors, the identity theft resource. There's so many things online. I think Jennifer said it recently. If you just go into that internet search engine and plug it in, you can find supports all over the place. But I would be remiss not saying that APS is a great resource for victims.
Perfect. Clarence, anything else you want to add?
Sure. Just piggybacking on what Jen stated, HHS OIG tips hotline website is a wealth of information. If you just follow that link and click on to fraud and go to Operation Care, that'll give you a list of partnering agencies that can assist and provide resources to victims in need.
Great, thank you. And then Jenny, anything else you want to add?
Actually, I'm going to save that for question 11, so not to be
Okay.
duplicated.
All right, very good. Okay, speaking of question 11, here it is. How can I educate my parents about fraud? Jenny, perfect segue.
Okay. I know a lot of the panelists, like I said, there's just so many amazing resources out there. Obviously, what I want to promote are the S&P resource organization resources there. At smpresource.org, under the top tab, it'll say Medicare fraud. These resources have been developed from actually working with Medicare beneficiaries and others who have certainly been affected by healthcare fraud. First, there are fraud alerts. Right now, those 3 fraud alerts, and there's a lot of detailed information to include infographics, fact sheets, and tip sheets, et cetera, on COVID-19, genetic testing, and hospice fraud. If you click on the fraud schemes kind of sub-tab there, there's just a wealth of information. Everything from ambulance fraud to home health, durable medical equipment. We've talked about nursing home and ID theft. Even telehealth. We recently added something on telehealth there because that's been an absolutely critical service during the pandemic. But of course, the fraudsters have used the opportunity to take advantage of that. There's information on how to read your Medicare card and read your Medicare statement, or how to get a new Medicare card, how to report it if it's been lost or stolen. And then finally, I think we have over 38 videos online at smpresource.org about how to detect healthcare fraud. We have some in Spanish and other languages as well, but how to even read your Medicare statement. So certainly there are many resources out there. I think each of the panelists can address this question, but I wanted certainly to promote resources offered by the Senior Medicare Patrol. Once again, smpresource.org.
Thank you. Other panelists? Clarence?
Sure, I'd like to chime in. Also, with the education piece, with the resources, which is critical, we also need to be familiar with the standards of care, just as individuals that we can, one, educate ourselves, and then we can also educate our loved ones. So I think on top of providing the resources, we have to have an understanding of what to look for and be aware of.
Okay. Aaron or Jen, anything else? Okay. Home stretch here. Question number 12. What are the best ways that older adults can protect themselves from fraud? Jenny.
I'm going to sound like a broken record, but it's important to do so. Is it unsolicited from someone you didn't know, right? And are they asking for something? If you remember those 2 things, those are just some of the best ways that adults can protect themselves from fraud. The red flag should go up. Is that an unsolicited request via phone, via internet, via mail and print, or a knock on the door? And 2, are they asking for something, especially if it's personal health information or personal identifiable information?
Perfect. I know we've hit on these points a number of times throughout the discussion. Anything else the other panelists want to offer at this point?
You know,
Okay.
when we in APS are always doing outreaches to the community, we say if it sounds too good to be true, it typically is, or if they're pressuring you, this is a once in a lifetime opportunity and you have to sign up in the next 3 hours. It's like, don't be pressured. So it's the same thing. If it's unsolicited, if they're pressuring you, it's time is of the essence. It's just, you know, not so.
Yeah, for sure. And I would just offer too, I think we talked about it earlier, in the discussion about just utilizing open source resources. Oftentimes just putting in an offer solicitation into Google will return, fraud scheme, right? So just things to bear in mind, use all the resources available to you. Okay, question number 13, how can I help victims who have diminished capacity? And that's for you, Jen.
Clarence, did you want to say something before I dive
I
into
just
this?
wanted to add one point as far as, providing PII over the phone, just trying to vet who you're sharing that information with. I think that's critical in the odor abuse community. A lot of, again, feeling pressured and they have to provide that information immediately. One thing that I'll tell my mom, do not give your date of birth, social to anyone that calls you unless you call me first. So just would like to share that. Do not share your personal information over the phone unless you know exactly who you're talking to.
Right. I tell my parents not to pick up the phone, but that's just difficult sometimes. So how can I help victims with diminished capacity? My first thing in my 18 years working in adult protective services, if you go out to someone's home and they seem really out of it, and it's not, it's not been a chronic type of progression, is to get them to a medical professional, because there's so many medical symptoms that are treatable or reversible. A simple urinary tract infection can cause incredible confusion. So if their baseline is not somebody that's like got dementia that's progressing, it's get them to a medical professional. Obviously, depending on where they are on the spectrum of diminished capacity, creating a plan for the future, getting that power of attorney. If there's a physician that says they still retain the ability to appoint a power of attorney, agent under power of attorney, and have that trusted someone on your accounts or in charge of your finances. If there's risk, obviously call the police or APS. And just one thing that I've really started reading more, because like I said, in Philadelphia, I worked with just older adults, but I'm learning a lot about the 18 to 59 community, 18 to 59 years old. And there's an entire movement, the supported decision-making movement, which is really about, allowing people to make decisions for themselves, even if they have a diagnosis. And, if they are making decisions that are in their best interest, support them. And again, it goes back to our whole philosophy of self-determination and autonomy. But, diminished capacity is quite a broad range. So starting with the individual is always something we try to do. So that's mine.
Great, thank you so much. Okay, final two questions before we turn it over to everyone else if there are additional questions. But question number 14, is there a statute of limitations for crimes that involve Medicare or Medicaid? Aaron.
Yes, there is. Again, short answer, there's a statute of limitations. It's 5 years. So, but to drill down a little bit into that, I think it's important to consider what statutes are charged in healthcare fraud schemes. Typically, these are Title 18 United States Code sections. There are 3 that are typically relevant. They're either mail fraud, wire fraud, or healthcare fraud. Additionally, sometimes money laundering is charged. There are a variety of other statutes that can be applied in specific circumstances, but those are the ones you see the most of. And the reason I mention those is because the elements of proof for those specific statutes relate to either mailings or wirings. And those are things the victims are going to want to hold on to in order to help us prove that crime. So if you received an unsolicited mailing from someone, that's something that we are going to want to get and put into evidence. We're going to want to utilize, the dates on those, where it was mailed from, where it was mailed to charge that as a crime. the same with wires. If you have unsolicited emails that are part of a scheme that initiate that scheme, and then perhaps emails that continue thereafter that evolve into telephone calls with the older adult, those are all things that we would want to save and track, and the FBI or HHS will want to capture those in their original state. In order for us to charge a mail fraud, the mail doesn't have to cross state lines, but the wire does. So if your loved one is receiving a call, it used to be easy when it was a home phone, right? Everybody knows where you answer your home phone. It's in your home, and we all know that where that is. Now with cell phones, it's important to know where that person is receiving that call, and we'll have to track where that call is placed from, because it has to cross state lines in order to be charged. Those statutes, healthcare fraud is a 10-year maximum penalty for each count. Typically, you don't see them getting charged or those counts being stacked, so they get 100 years of jail time. But the mail fraud and wire fraud counts are 20 years. So it's the sentences are all driven by the amount of loss. And so when you have these big schemes, these telemarketing schemes that cross the whole country and total millions, tens of millions, perhaps hundreds of millions of dollars, that's that's how we calculate the loss and how much potential time the person's going to get. But that all starts with that one piece of mail that gets saved by that victim, or that one phone call that they make note of. So please keep that in mind. And so from the start, from the very last element of the crime is when the statute tolls. So if your loved one tells you, oh, this happened to me, and they don't share it with you right away, and several years pass, that's fine. You have 5 years. So 5 years from the point, of course, it's always easiest to investigate crimes that are still happening or have happened in the most recent future. But if it's something that happened 2 years ago, please don't dismiss that as something the FBI or HHS wouldn't be interested in. Please give us a call. It's probably the tip of an iceberg, and we can run it down from there. Thanks.
Yeah, great point. And just to amplify there, just because the activity may have stopped for a particular victim 5 years ago does not mean that the fraudster himself or herself has not continued to engage in the scheme, and that would be conduct that we'd be able to charge as well. So just something to bear in mind for everybody. Okay, final question. What interventions are possible in cases of self-neglect? Jen.
All right, this is a change of pace, right? So again, I would say speak with the older adult to try to determine the underlying cause of the self-neglect. Sometimes, like I said previously, older adults don't want to let others in because they have the fear of losing independence and maybe being institutionalized, having to go to a assisted living or a nursing home if their family pressures them. So really to speak to the person and try to get to the underlying cause of what kind of support they may need. If they're willing to accept supportive services, every county in the country has an area agency on aging, and so there might be other nonprofits in the county that could provide services, and there's programs to be assessed for that you could determine their eligibility based on functional needs assessments and finances. The other thing that I really want to hit home here is self-neglect. There was a study by Dr. Carmel Dyer out of the University of Texas, and she found 95% of those who neglect themselves had little to no social support. So social isolation and loneliness are really, really risk factors for neglect, self-neglect. And oftentimes, if there is a perpetrator involved, this isn't true with self-neglect, they enforce or impose that isolation on the person. So really staying involved, visiting your loved ones, and then if they do need the supportive services, just talking with them and finding out what they need. There may be a compromise in there somewhere. They don't want somebody in their house every day of the week, but they may accept something, 3, 4, 5 days a week. So hopefully that provided some insight in that question.
It certainly did. Thank you so much. Okay, so we've worked through the questions. Amy, if you can help me out here, I don't know if there are any other questions that have either not been addressed by the panelists or by the folks who are monitoring the separate chat discussion. Amy, you
Yeah,
seen
and
anything before we turn it?
our team of experts on the back end has done a great job of keeping up with the questions submitted by our audience members today. But there is one that has come in the last moment or two. It's one that has come up earlier in the series, but it's a really tough one. So this one, anyone on the panel could probably add some input. The question is, what can we do for an older adult with capacity who's caught in a romance scam and will not stop talking to their abuser? What can you do with that? Anyone want to chime in on that? That's a tough scenario.
I can speak to this. We just had a scam advice call last week. NAPSA hosts these, and there is I need to Google it really quick, but there is a romance scam support group, and let me look for it while the others may pull up that information, and I can put it in the chat because it was a great. It's a 10-week program where people that fall prey to a romance scam have others that they can talk to, and the people that are leading the support group have already dealt with the situation. So I feel like the people that are leading the scam support groups have more street cred, if you will, because they've already been through it and had to deal with the situation. But I'm going to look that up right now while I let others talk about the romance scams.
Okay. Anyone else want to offer some advice? Yeah,
Although
other
this is
than,
not, although this is not my area of expertise, I will tell you that just in coordinating with the AARP, there are many agencies out there, but the AARP has some excellent resources regarding dating and romance scams. That doesn't really directly address the question, but there may be something in those resources that would help deal with the individual that just cannot stop getting involved in that romance scam or other romance scams.
yeah, I mean, I would say from the FBI's perspective, certainly report it, right? As Aaron mentioned earlier in the discussion, IC3 is a great resource. It's largely part of a larger scheme, and we certainly have a number of instances here where we have engaged with victims and had to at times spend hours with folks trying to convince them, educate them that we are who we are, that the person that they're talking to does not exist, that they are, a victim of a fraud scheme. And so that's what we take on. It's not all that unusual, but it first starts with us being aware of it and engaging with the victim, and obviously bringing other resources to bear.
I found the link. It's fightcybercrime.org, and they have the peer support program, which seems like a tremendous resource. And more of these programs have cropped up across the country because it is a really hard case to really convince somebody that that person is not real. I remember AARP had a great article titled, "Are You Real?" And it was all about a romance scam where the person never saw him, sent hundreds of thousands of dollars to him, and it's an area that really frustrates a lot of financial institutions because the person's not coming in and they're not displaying full-blown Alzheimer's disease. They're in love. So it's like, how do you convince them that they're not seeing this person? They're not real. But these support groups, if somebody's open to it, could be powerful. Hope that helps.
Yes, it does. So anything else before we roll to closing comments? Okay. Yeah, certainly want to be sensitive of everyone's time. I think we're well within the timeline here, but I do want to give the panelists an opportunity just to give some summary level comments. So I'll start with you, Jenny.
Yeah, as you know, my main point has been, is it unsolicited? But I'd like to give you a recent example that shows the power of using that as a decision-making criteria. At the beginning of the pandemic, the robocallers were calling the Medicare beneficiaries. Hi, this is Becky from Medicare. As a result of your medical history, we'd like to get you scheduled for a COVID-19 test. What is your Medicare number so I can get you scheduled? And of course, they were soliciting just for the Medicare number. That's what they were trying to get. Recently, what we've seen is that the robocallers are working with info brokers, information brokers, to have some information to do social engineering on that call. Now it's, hello, this is Becky from Medicare. Mrs. Jones, yes, I see that you live at 123 Acme Street, correct? Okay, that's correct. And your date of birth is da-da-da-da-da, correct? Good. Listen, as a result of your medical history, we need to get you, we're going to go ahead and consider you a priority for the next COVID-19 vaccine booster. And look, just go ahead and get your social security number so I can go ahead and get you scheduled. So that's where the robocaller has some existing information, some existing PHI, PII, personal health and personal identifiable information to help convince that senior that they're legitimate. But what is the determining factor in that? That call was unsolicited either way. So while it doesn't apply to every situation, the first red flag should be, is that unsolicited call, unsolicited door knock, unsolicited email, unsolicited letter. And that will be a helpful criterion to you.
Great, thank you. I think really important point about the level of sophistication with some of these schemes, just getting increasingly more complex, intricate, involved, really requires us to pay attention, ask questions, but starting with not volunteering information, paying heed to the advice if it's unsolicited, antennas should go up. Okay, Jen.
I really like the unsolicited piece of advice. I guess what I always used to preach when I would go out into the neighborhoods, I'm talking to communities or senior centers or groups in senior housing buildings. And what I always like them to do is take it away and have the conversations with friends, family, anybody that'll listen, to get the prevention aspect out there, to get out the word that if it's unsolicited, don't answer the email, don't pick up the phone, anything that's unsolicited, don't do it. So, that also kind of weaves in the social isolation component I spoke about earlier. And if you have people that in your life that are socially isolated, keep in touch with them, share this information with them, because they are the ones that are definitely more at risk. But having some kind of prevention plan and really just having the conversations with your loved ones is the best prevention I can think of. So that's my takeaway.
Outstanding, thank you. Clarence.
Yes, my takeaway would be I would recommend every older adult having an advocate or advocates, understanding their medical needs, visiting them regularly, and when they are visiting, making sure they have a proper nutrition, minimize injury or wounds, especially, typically buttocks or feet if they're in an institution and not being moved regularly. So just, again, having advocates that's gonna, take care of them and have their best interests in heart.
Great, thank you. And Aaron.
Thanks. I'll circle back real quick to where I had the technical difficulty. One other piece of advice I wanted to give on the hospice care on the pharmaceuticals is when you get to the point that that your loved one has passed and you have those medications to dispose of, please go to fda.gov and look up drug disposition. You will find there a resource, a tool that you can put in your zip code, and you can find, I did it for my own zip code and found about a dozen places within 5 miles of my house that I could take those medications and securely dispose of them. Don't flush them down the toilet. Don't throw them in your trash. People go through trash looking for things like that. But go to fda.gov for drug disposition in those hospice cases. And the thing I will add is that 20 years of working healthcare fraud cases, my best cases came from the victims. They all came from victims originally. There's data mining that can be done by us and Medicare, Medicaid, but at the end of the day, somebody has to be a victim in the scheme in order for us to make the case. And don't be intimidated by that either. Just because your loved one is maybe the first one to give that tip, that doesn't mean that we're going to necessarily call that person as a witness in the case down the road. It gives us a start, though, at least. And we don't make these cases typically in a healthcare fraud type case off of one person. We're going to need dozens, if not hundreds, of victims in order to make a strong financial case. So please do make that call or go online and submit that tip at either the FBI website, the HHS website, IC3, as mentioned. But please make that call, because that's how we make these cases, and that's how we shut down these fraudulent providers.
Awesome. Okay. I do want to thank the panelists for their time, their expertise, all the great information they shared with all of us today. I am going to steal Jenny's PDR one last time, just as a nice way to sum all this up, right? We're in the business of prevention through education, right? That's hopefully what we're able to accomplish today. All of you now are in a position where you can be ambassadors, share information that was shared with you, with colleagues, friends, loved ones. Following that, it is paying attention, right? Detect, asking questions, paying attention to details, and then when all else fails and when in doubt, report. Use the resources that were shared with you here today to help you work through, I'm sure, some challenging and complex situations and problems. So that is all from me, and I'll turn it back over to Amy, who I think has some closing administrative comments to make.
I do, and wow, what another great session, just chock full of information. We hope that you've taken away something that you can use in your life right now to protect yourself and your family and your clients and your friends. Do remember that you will get an email tomorrow that confirms your attendance today with a certificate, so you can submit that for continuing education credits if that applies to you and your job. You will also see when you depart this webinar and again tomorrow a link to a 2-question survey. So very interested in your feedback about what went well today, could we do better for next time. We please implore you to share this information as widely as you can, because all of us have a common mission to keep the country safe. So please do stay safe. Thanks to all who attended and listened today. Thanks to all who answered questions today and engaged in conversation. And we'll look forward to the next time we see each other online. Until then, take care, everybody. Stay safe.